How we're doing today, we're going to be discussing the Webster technique. The Webster technique allows us to evaluate the expecting mom, make sure the pelvis is nice in line, more importantly, there's a nice equal balance in that pelvis. So what we're going to do is we're going to evaluate the structure, the bones around the pelvis, the lumbar spine, the sacrum, but also we're going to take a look at some of the soft tissues around that area because we want the muscles, the tendons, and the ligaments to be nice and happy. Okay, so first of all, structurally, we're going to make sure those bones are aligned properly. So what we want to do is evaluate the pelvis, see which leg's short. A lot of times that tells us that there's one pelvis rotated, causes some pain or some restriction. And like we mentioned earlier, we do not want any pain or restriction because that causes some torsion in the pelvic area, more importantly the birth canal and also the uterus. So we can take that tension out of there, and then we want to work on the soft tissue. So we're going to adjust these bones here to get things back in place. Good. Then we got a spot here. Another instrument that we like to use here is called our activator. This is very gentle and effective, getting these bones back in place, taking a lot of tension out of that lumbar spine in your pelvic area. So we'll find the bone that is subluxated. We got one spot right here. We'll get that back in place. And therefore we have done the structural part and get the bones in the pelvis back in place in that lumbar spine. The next thing we're going to be doing is going to be looking for any restrictions or tension in the tendons and ligaments. So a lot of times we see back pain and hip pain comes from either your piriformis muscle getting taut or maybe that sacrotuberous ligament getting taut. So we're going to kind of poke around, make sure those areas ain't too taut and inflamed. And once we find an area that is tight, we'll work on that area, get a little tension so that tendon and muscle can relax. This typically takes a few seconds getting that tension out of there, but more importantly, as that tension is out, pelvis is able to relax, move, and as we're growing, pelvis is moving in the proper position, baby's having room to turn, delivery process is a lot easier. So we do the back side of things, but also we can work on the round ligaments, your iliopsoas muscles, and your hip flexors to make sure this is very comfortable for mom, but more importantly, as we get closer to that delivery date, things are comfortable for baby, make sure they're in the head down position, easier delivery, easier labor, all that good stuff. So if you're having any questions or any issues, give our office a call. We specialize in prenatal care, and we're here to help. Thank you.